Ani, Buju, Kinuiaik, Gawi Bajaik, Nongo, Mabagani, Nanakwaiaik, Nogovi, Kamugoyain, Mabagani, Chigima, Gawi Bajaik, Mampi Buaning, Mabagani, we end up going mean goyan and Mamjago mean goyan in the Goknam. In English, today is very historical within the tribal lands of Mawaring. And one of the things that is always reminded of us as an Anishinaabe is our kindness and our openness. Not to the physical realms or the human realms, but to the spiritual realms of territories and lands. And throughout history, there's been great leaders known as chiefs. And the building that we're in today carries that name, Niigaanagiizhik. And sometimes we as Anishinaabe fail to remember our greatness within the hierarchies of governance. A lot of the things that we have around our tables, around the fire, around the earth, around the water, and around the air is a responsibility for all life. And in accordance with Anishinaabe ways of governing, that was our priority, was understanding those elements of all life. Water being one of the most important ones, and earth being another importance as a first mother. And the breath of air is within our lungs, but also the one that's often misplaced in all of us is the spirit of where it is that we come from. And each human being on earth has a beautiful story known as creation. And there's always a neutral in the understanding of that. These words that I'm going to speak is pretty much in a foreign language to a lot of us, but it isn't to me, and it isn't to the forefathers and the foregrandmothers within this territory. There is a beautiful language known as the Chippewa language. I guess they call it Niigaanagiizhik. But my name is Niigaanagiizhik, and is I know a little bit about medicine, and I know a little bit about the ceremony. But where I work in the tribal health center, there is two people that were here before me. One of them was a Niigaanagiizhik, Harlan Dowman, and the other one was an older man from Minnesota. His name was Lucier Adam. And those are the ones that I want to give thanks to for allowing the chairman to being strong enough to invite me for this special occasion. My grandmother always said this to us. There is going to be a historical time in my life where I meet important people, and never to be intimidated by them, but to be respectful of them. In this song, it talks a little bit about this, and I'm going to go right into the song right after the words of all of creation for us in the gathering of Mawaring. And to be mindful of each other, and always believe how powerful prayer is for fellow human beings on earth, because there's a lot of human beings on earth that need prayer right now. Nahambushu. Bejo yan get the almenidok, Mamagan Winish Gabeos, Mamagas Gaskigizes. Pane winning in on da, the Bajmagoya, Anishinaabe, Gamin Goyang, Pane Goyang. Maniga Winnie Aki, Gawinigi Min Goyanish Kikmikwe. Mamagan the Be, then a mom the Goyan and Mamaganish Kik. Modigan Nodin, Kiniga winning in on da, Sugo Gamin Goyang and Pane. Mabigyan ng Ostagoyan and Shubigi, Mabigyan of Spimming Winash and the cousin. Mabigyan ni Winigin on Ostagon of an Abnoya Bidaban. Mabigyan Winigin on Don Apawagan. Can I get Winigin on Ostago Nimki Abanesi? Can I get Winigin on Don Nopnoya Osnodean? At the beginning of the day, Bidaban. In the middle of the day, Nimki Napawagan is the rainbow. Over there where the thunderous thing, Nimki Benesi. And where the medicine dances, Wasnode. Those are the four directions in spirit. Gima nunda nigeya, gima ne we geya ne wendum no ya. Wine ya ne gima ge ne gami go ne besho ya ne getege, besho ya ne getege ne minito ya ne. We get ya, we get nundage, we get ya nendo, kenege ga we brisha, kenege ga we brisha, kenege ga we brisha, ya. We ne ya, we ne get nundane, kenege ga nindane, gimingo ne namgo yam. I give you that too, but it isn't mine.
Ready? Ani and welcome. As chairman of the Sioux Tribe, it is my honor to welcome First Lady Dr. Jill Biden and Second Gentleman Douglas Emhoff to Sault Ste. Marie, or as the Anishinaabe people know it, Bawatane, which means place of the rapids. I also want to thank Assistant Secretary of the Department of Interior, Mr. Brian Newland right here, and Office of Management and Budget Tribal Advisor Elizabeth Molly-Carr for joining us on this visit. For those who don't know, Mr. Newman is the former president of Bay Mills, and Elizabeth is a Sioux Tribe member and the first person to serve in her role at OMB. We are thankful to have such great friends in the Biden administration. I also would like to recognize Sioux Tribe Vice Chairman Tyler LaPlante and Director Kimberly Hampton, who have joined us for this important conversation about healthcare services. So I appreciate the two of you being here as well. Before we begin this conversation, I feel it's important to set the stage. The Sioux Tribe is the largest tribe in Michigan, serving roughly 50,000 members with 15,000 residing in our 7-county service area. We administer 23 governmental divisions and manage over 75 federal, state, local, and tribally funded programs, including the operation of 9 health clinics. Our Tribal Health Division offers a wide range of services, including medical, dental, nutrition, pharmacy, traditional medicine, and a very strong community health education program. We are able to provide these services thanks in large part to the trust obligations upheld by our partners in the federal government. Recently, the Sioux Tribe undertook a concerted effort to reevaluate and reassess the quality of care and services that we deliver in the community. We announced just this week that we will be implementing a 2-year healthcare revitalization plan to increase access to care and improve the quality of healthcare services that we offer to the community. So with all that said, this visit and discussion with our partners in the Biden administration is very timely. Thank you for your continued collaboration and partnership, along with your willingness to listen and have an open dialogue with us here today. I'll now turn things over to Bay Mills President Whitney Gravel, who is a strong leader and who is also a champion for healthcare in her tribal community.
Thank you, Chairman Lowe's, Ani Bojo, Niigaanagiizhik, Indishnakas, Ganushnakani, Donchaba. My name is the woman who stands in the north, and I currently serve as the president of Bay Mills Indian Community. Thank you so much to everyone who gathered here today to talk about healthcare, talk about providing access to healthcare to our tribal citizens, as well as the Eastern Upper Peninsula. I wanted to share a story with everyone about Bay Mills Indian community and really where a lot of our healthcare initiatives have come from and what they've been inspired by. For those of you who don't know, the Bay Mills Health Center is actually named after Ellen Marshall, who was a traditional healer and one of Bay Mills Indian community's ancestors that was known far and wide for her dedication and well-being to the health of men, women, and most especially children, both native and non-native throughout the Upper Peninsula. Back when vehicles were very rare in a rural area and actually did not exist in the Upper Peninsula, Ellen Marshall would pack her medicinal bag and would walk for miles and miles and miles and sometimes days to be able to help families deliver babies, provide medicines for common colds. She would go out into the fields and gather traditional medicines to help cure tuberculosis, influenza, as well as other illnesses. I call upon Ellen Marshall because I hope she's here with us today as we're talking about healthcare, because she could not be a more perfect symbol for the staff as well as the leadership that are here and part of the Bay Mills Health Center team as well as the Sioux Tribe team. Our health professionals at the Bay Mills Health Center and other agencies have endured many, many hardships, especially over the last 2 years in their professional careers, as they sought to expand healthcare services across the Eastern Upper Peninsula. That was largely in part due to the COVID-19 pandemic. And, even in the most normal of circumstances, providing services, taking care of one another is already hard enough. You are seeing people at their lowest, at their most hurt, and at their most vulnerable. And then to face all of that hardship and work as our teams did during the global crisis is truly something to be proud of. I'm extremely proud of the way our tribal nations came together during the COVID-19 pandemic and were able to provide vaccines and in many different clinics provide vaccinations to upwards of thousands of people that came from not only across the state of Michigan, but also Wisconsin, as well as Ohio and Illinois. I share all of this just to highlight how far our teams are willing to go to be able to help one another, much like Ellen Marshall did in the past. The Bay Mills Health Center has been able to take that vision, take that inspiration from Ellen Marshall, and not only provide services at the Bay Mills Health Center, but very recently opened up the Niigaanagiizhik Dental Clinic here in Sault Ste. Marie, recently established a walk-in clinic in Burley, Michigan, and then also provided dental and optometry services, one of the few in the Eastern Upper Peninsula that accepts Medicaid. Our team has been able to provide more than 21,000 visits in a single year and service more than 3,400 patients, both native and non-native, which is nearly 10% of Chippewa County's total population. And so just to highlight again, we are small, but we are mighty, and we care about one another, and it is through that care and through that love and compassion that we are able to continue to provide a variety of services, not only dental, medical, behavioral health, or substance abuse and optometry, but also our cultural services offered through traditional medicine, because that is rooted in who we are as a people. It's rooted in how we understand our relationship with the natural environment, and it's rooted in how we understand our relationships with our ancestors as well as the future generations that will come after us. And so I want to thank everyone here again today for joining us for this conversation. I'm very proud to turn it over to the second gentleman, Mr. Douglas Emhoff.
Thank you so much, President Emhoff. Thank you so much for the hospitality that you've shown the First Lady and I the last couple of days. It's been incredible. And Chairman Lowe's, thank you so much as well for hosting us here at the Cultural Center. You can tell this is a special place. It's a place that preserves the traditions that are handed down by the ancestors, so we can feel that in this room. But today we're here to listen and learn about the healthcare challenges that you've already alluded to. We know that Native communities face lower life expectancy, higher morbidity rates. It's due to geographical isolation, economic adversity, and frankly, discrimination in healthcare services. Tribes deserve quality and comprehensive health care just like every other American community. And as you were saying, Madam President, when the pandemic hit, all of the problems in your health care systems were made worse. The pandemic shed light on what the actual needs were in Indian country. We saw outdated facilities, few inpatient beds, and provider shortages all created acute problems. Anything that was bad was made worse. We took office, or our spouses did, during that horrible time, but they put us to work. And I know the First Lady and I traveled the country, including to Native communities, right in the heart of the pandemic. And so we saw firsthand what you were talking about, Madam President, about the response was incredible. I myself, my first trip ever as second gentleman was to New Mexico, to the Santo Domingo Health Center with the Kiwa Pueblo. Same issues. Everyone came together to get that community vaccinated. It was an emotional experience because a lot of the elders had died or were dying. And a lot of it was for the health of the community, but it was also to preserve the culture, preserve the language. So that was one of the reasons everyone came together and got folks vaccinated. So we have to show up, we have to listen as an administration, we have to be partners to support your communities, just like we're doing here today. I am proud to be a part of the Biden-Harris administration. We have made sure with our leadership that Native communities have what they need and will continue to have what they need to stay on track after COVID. The President has made the largest federal investment in Native communities ever to assist in recovery. $20 billion in emergency funding for tribal governments, major collaboration between tribal leadership and the administration. This Eastern Upper Peninsula came back from the difficult challenges faced during the pandemic because of this partnership and leadership. We are going to continue to be there for you. We're going to continue to listen and learn, which is one of the major reasons we're here. I want to introduce someone who needs no introduction right now, someone who has really dedicated her life to us as a teacher, as a mentor, and a role model to so many, including me, our wonderful First Lady, Dr. Jill Biden.
Thank you, Doug. Good morning. Ani. I want to especially thank the little children who are sitting here, because I hope your moms promised you ice cream or something, to have to sit through this. Or color books, at least something. All right, so Chairman Lowe's, this way. President Gravel, thank you for your kindness and your leadership, for living the good life for your communities. And it's so wonderful to be here with Brian and Liz, and Joe and I are grateful to have your voices and your vision as part of our administration. So yesterday evening, this community welcomed both of us with so much warmth. And I had the opportunities to speak about my sister and how communities can come together to find healing and hope. So it's an honor to be with you all again to talk about your communities and how they've come together to address tribal and rural health. Because your health matters. And that's why my husband Joe's administration has taken historic steps to support the incredible things that are happening at tribal health centers like the Sioux Tribal Health Center and the Bays Mill Health Center. For the past 2 years, he's made sure that the Indian Health Service and the tribal medical services it funds can continue to provide life-saving care without interruptions to their budget. And he is committed to making that true every year going forward. He's fighting to increase the IHS budget and make sure it's stable and continues growing over time, so that health systems like yours can continue to flourish. And Joe is honoring the nation-to-nation relationship, providing you the funding and flexibility you need to design the health systems that work for you, because you know best what you need. And when tribes operate their own health systems, you make sure the care meets the needs of your communities. When people here are able to access consistent care, when they don't need to drive miles for treatments, which I've seen all across this country, and when grandparents don't have to live in pain from an infected tooth, and mothers get the prenatal care they need close to home, and children grow up knowing that there's always someone that they can talk to during their darkest days. When lived experiences are at the center of care, it changes lives and saves them. We're here to learn about what's working and how we can continue to be your partners, and what we can do to support other communities who wish to do what you have done here. The second gentleman and I are listening, and so are your president and vice president. We are committed to working with you so that you can thrive. Brian?
Thank you, Dr. Biden. Thank you, Mr. Emhoff, also for taking time and listening. You know, President Gravel had mentioned briefly some of the work Ellen Marshall did with respect to tuberculosis. When I was a young baby, we had a tuberculosis outbreak in our community here, and I actually contracted tuberculosis and was hospitalized for weeks, and there was no doctor in our community to treat me. And so my mom was 18 years old at the time. My dad was just a few years older and had to travel over 100 miles one way to be with me while I was receiving tuberculosis treatment, which is a disease that most communities in the United States don't ever have to encounter.
No, that's right.
And because of the things like the Affordable Care Act and the investments in tribal health facilities like we've seen here, people in our communities in this part of Michigan don't have to encounter those types of challenges as often. And so that's a blessing. It shows how far we've come with some investments and commitments to do right, and the president and vice president have made that clear. We want to make sure we hear from the folks doing it today on the ground, and so Vice Chairman LaPlante will turn to you first to talk a little bit about your work, and we could probably spend all day talking about these issues, but we'll ask folks to try to keep your comments concise, just a couple of minutes, and we'll make sure we hear from everyone.
Ani Boozhoo, Niigaanagiizhik, Bauting the Dojba, because they don't understand the my name is Eagle Feather of Eagle Clan, also known as my colonized name, Tyler LaPlante, Vice Chair of the Sault Ste. Marie Tribe of Chippewa Indians. I appreciate Brian already knows me pretty well, so I'll keep it brief. When we're talking about investing in America, there's nothing more important than healthcare and education of all of our people. Those two things are noted in our treaties, healthcare, education, and welfare in perpetuity. Not any percentage of healthcare, education, and welfare, but healthcare, education, and welfare in general. There's nothing more important to the economy in the United States than having a healthy, productive workforce that is also educated and able to hold the positions in the workforce. So with that being said, Bemidji area, the area in which we're in right now, the greater area, also known as HHS Unit 5, or Region 5, we are the lowest funded area in all of IHS, with in 2020 numbers, prior to the pandemic, being just 38% level of need funded. The level of need funded is extremely important for tribes in this region because that means we're funding the other 62% either through third-party revenue claims and reimbursement mechanisms or through our own casino endeavors and our own economic endeavors. That doesn't actually meet with the treaty and trust responsibilities because we are still taking on the burden even though we've traded our land and our blood for the paths of the treaty rights. So while I appreciate everything that this administration has done because it has done far more than any other administration for us, there's still a long way to go. including mandatory funding for IHS services with a price tag of $60 billion. That's what is estimated to actually capture what is needed in our tribes, in our communities today across the country. Beyond that, working directly with the federal government and CMS. Now we understand that CMS has the ability to work with states independently. However, our contract through our treaties is not with the states, it's with the federal government. And not having access directly to CMS and being able to access reimbursement mechanisms that would otherwise be available to us without going through state plan amendments inhibits our abilities to perform our medical services and reimburse the claims that we receive that IHS does not cover on their end. So while we are doing fantastic things and we are moving forward with our healthcare revitalization plan, we could still use a lot more help when it comes to government relationships. Thank you very much.
Miigwech, Vice Chairman. Director Kimberly Hampton.
Anin Buju Wabishkabi Shakekwe Mekadak Donam. My native name is White Buffalo Woman. I am from the Turtle Clan. My colonized name is Kimberly Hampton. I am Director and Secretary of the Sioux Tribe. I want to say thank you to everybody who is here today, all of you at the table and all of you out there. It means a lot that you would be able to come here and have these conversations with us. As Chairperson Lowe's and Vice Chairman LaPlante has said, we are in the middle of a healthcare revitalization. So we will be looking forward to, I guess, working more with you guys and working on those government-to-government relationships. We also want to thank you for all of the work the Biden administration has done for ICWA. That has been a huge relief for all of us. I also want to quickly point to environmental. So I am Vice Chair of the first ever Department of Homeland Security's Tribal Advisory Council, along with 14 other elected tribal leaders throughout the U.S. And I have really enjoyed working with the administration over the past year. We have had lots of briefings. I am really thankful for all of the tribal consultations that we've had with the Department of Justice. And I want to I would like to share that Sioux Tribe has a wild rice monument initiative. So we have been working on replanting wild rice beds. Mm-hmm. And because of that, part of my role on the Department of Homeland Security's TAC is to make sure that local Homeland Security agencies are not just going about their own projects without consulting Sioux Tribe and neighboring tribes. If they were to come in with some sort of an initiative where our rice beds are, it could really set us back a lot of progress. And as everyone knows, we are working on that, but that goes towards the betterment of our community and all of our communities as a whole. So just want to say thank you, and we really look forward to strengthening government-to-government relationships. Mm-hmm. So, miigwech.
Thank you.
Miigwech. Now we'll turn to Bay Mills Indian Community Health Director Lucy DeWitt.
Thank you. Thank you, Brian. Thank you for allowing me to speak today about our health center, Bay Mills Health Center. Health centers are not just primary care facilities where you can go get your annual physical or go for an earache. We're a complete facility. We are Joint Commission accredited, which holds us accountable to the industry's highest standards. If we have patients that have needs, we find a way, whether it's helping someone with disability paperwork or just loaning out crutches for the weekend. We track and continually find new ways to improve health measures, like what trimester a pregnant mother receives her first prenatal care, measuring our breast, colon, cervical cancer screenings, and screening rates for depression with a follow-up plan. I'll illustrate just some things that we are doing at the health center above and beyond regular visits. We were recently approved through the state of Michigan to have a school wellness program. This will be at the local public school and will provide a registered nurse and mental health therapist to serve the students at the school. In addition to this, we renovated a space within the school and are staffing it with a nurse practitioner for medical visits. This will help students and even staff. All of this will help with absenteeism, one of the biggest, if not biggest, predictors of performance and graduation rates, and also take stress off of our educators. Our small but mighty behavioral health program had over 6,000 visits in 2023. I could give you a lot of statistics for them, but instead just want to provide you a few examples of what our team does above and beyond patient appointments. This is what makes me the most proud. We received a patient comment recently that said, quote, "Bay Mills Health Center got me sober." In the fall, we were contracted by the local school and our police department with concerns in a recent large increase in suicidal ideation in the adolescents at the school. Within 2 days, we sent a team to the school to hold a suicide prevention presentation for the entire school. We're currently working on a grant that will provide a drop-in center for our clients in recovery. This will provide guidance through our peer recovery coaches, provide sober engagement through activities, and provide a much-needed alternative for social places for them to hang out. In some of our other departments, our social services department is creating a child advocacy center for a 3-county area, and we are training 2 sexual assault nurse examiners currently. These will both serve victims of abuse. Having a child advocacy center and a sexual assault nurse examiner makes prosecution of cases much easier and much more successful. Our newest addition to services has been mammography services. We have that up and rolling now, and as of February of this year. I could go on and on with example after example, but health centers are more than just having a dentist and a doctor on staff to see patients for appointments. We find the need and we fill the need. That's what we do. Miigwech for your time.
Thank you.
Miigwech, Lucy. And now we'll hear from Bay Mills Director of Community Health, Stephanie Phipps.
Ani Bonjour. I'm going to, we didn't even plan this, but small but mighty is in my notes too. So I'm going to trickle down from Lucy and talk about community health department within the health center. I'm sure you've probably heard before through other communities that generational trauma affects us all. That's evidenced in our communities here too, with the chronic diseases and the substance use that we see in our small communities. But Bay Mills Community Health and the rest of the departments, a lot of the programming that we have works to address those disparities, and most of them have a cultural component, if not a cultural focus. So I'll just list some of the programs we have in our department. We have home visitors that work with young families to live that healthy life. Good parenting choices. We also take that a step further. We have a home visitor that will specialize with families affected in some way by substance use, to give them those extra, access to resources that they might need. We have a community health nurse and community health representatives that go into the homes to provide services when needed, mostly with elders that need it, anything from helping them with their blood pressure machine or setting up their medications. Transportation is a huge issue in this area, and we work to combat that by providing transportation, access to the care that these people need. We don't have a lot of specialists in the area. We do have to travel miles to get there, so we can meet that need with our transportation services and community health, which leads to improved access and improved healthcare outcomes. We also promote overall health and wellness through physical activity, food sovereignty, and healthy eating habits. So we have a nutritionist on site that it's not just about, creating that food plan or working on that diet with you. She actually goes into the community, and she's very active in our elders programming to provide education and support for them in a fun way. And then we do a lot with partnerships and collaborations throughout the community to provide a variety of services. I mean, that's community health in a nutshell, but some of the things we work on is improving hiking and walking paths, I believe. You got to experience that this morning. Yes. Improved recreational access to our waterways, which has been huge. Improve access to fresh and traditional foods with our farmers market, which you may have walked by. All of these things, promote that good way of life. It's also important to note that the Bay Mills Health Center is actually open to the public, so we don't just serve our tribal citizens. We can, help the community at large here in this rural area. So that's been, since our inception in the early 1970s, we've been able to provide that service to others. and addressing health disparities and working on health prevention and promotion, it can be a battle, but it's not all bad, especially in community health. Laughter is medicine. Community is medicine. And so we get to do a lot of fun stuff in our small but mighty little department. And I could go on and on about that, but I just wanted to say Miigwech for your time, for taking the time to come and listen to us today.
Of course.
Thank you, Stephanie. And last, but not least, from our team, we'll turn it over to Liz Carr from OMB.
Well, Ani Bonjour, everyone. It's such an honor and privilege to be back in my home community, so thank you for welcoming us. As someone who grew up utilizing the Indian health system here in Sault Ste. Marie and serving as the senior advisor to the IHS director in my previous role, I can say without a doubt that the healthcare you all provide here on the ground is top-notch. It's incredible to witness the growth of both of your programs, and I think that progress is thanks to the ancestors that had that vision and then to the leadership of the two tribes here in this community. I am proud to serve the administration that secured for the first time ever advanced appropriations for the Indian Health Service and also proposed the first ever mandatory budget for the Indian Health Service. That's a really big deal, something that tribal leaders have been asking for decades, and our administration was able to get that commitment done. If you know Brian and I, you know we don't rest on our laurels, and neither does this president or the rest of our administration. And so we know we have more work to do. I don't know if you noticed, but I was taking notes while you all were speaking, and we'll follow up on those action items that you had identified. But I just wanted to say thank you, everyone, again, for welcoming us. You have our commitment to continue partnering with you, and we know that we can make great accomplishments together in partnership with the tribal nations here in the Eastern UP. And I just wanted to close by saying Miigwech for your leadership, your vision, and your continued commitment to keeping our communities healthy and well, or as we like to say, living that, bimidzawan. Thank you very much. And Miigwech, First Lady and Second Gentleman, for making the time to come up to Sault Ste. Marie and be with us.
Thank you. Thank you.
Dr. Biden and Mr. Emhoff, I think you've heard just the top level highlights of some of the incredible work both of these tribes are doing to build wellness in their communities. And before we conclude, I don't know if either of you have any observation or thoughts you want to share.
Sure. Well, I was going to say what you said, which is we don't just do this for show. We actually do this all over our country in so many settings, just to make sure we know what's happening on the ground. And the fact that you're both here, we will take that back and everything that you were talking about, and see again how we can make things. I'm glad you said that this administration has been doing such a great job, and we will commit to continue to do that and do more. Lucy, I just wanted to thank you for bringing up mental health, because when we talk about health care, we always have to talk about not just from the neck down, but from the neck up as well. And this is something this administration has been so strong on. We have an incredible other SG, our Surgeon General, who has really made mental health and loneliness and online and all the things that are exacerbating the trauma that you were talking about. We've got to work on that. So I'm so glad you were both bringing it up as well. So again, honor to be here and to participate in this. Like I said, we are partners, and we will take this back home. And Dr. B?
Well, Doug, that's a good segue, because I actually have some comments as a teacher, as a woman, as a mother, and as an American. So as a teacher, just like Doug said, I am still in the classroom. I've been in the classroom before the pandemic, after the pandemic. It's been 40 years. And so since the pandemic, I see mental health as so much more a greater problem. I see it in my students who were home and on Zoom and missing a lot of services, and they don't know, they're having a tough time coming back and being social again and knowing what it feels like to be part of a community. It's like they're tiptoeing back in to being social. And so I thank you for that, for what you're doing in the schools, and especially as we see the suicide rate increasing, and that we know that we're training teachers, to make sure that they see the signs. And I know that one thing that I see across the United States is we have given the states money for mental health services, yet we don't have enough psychologists to go into the schools. And that's a big problem here in this country. So we have to train more psychologists to then go in and help all these kids. As a woman, I just want to commend you for what you're doing with mammography. It's so important that women get, mammograms and take care of their health first. Because I think so many women, we're so used to, as moms, we're used to just taking care of everybody else, but we so often forget to take care of ourselves. And if we have to be healthy and strong to take care of the rest of the family. And one of the things that I just got involved with this past year is in funding women's health research, because many of you may not know this, but as many of us, half the population of this country go into menopause, we don't have answers as women. Like, why is this happening? What is going to happen? What can, we don't have answers to these questions. Why? Because research on women's health has been underfunded for decades. But that's going to change now, because when I took this problem to Joe, he listened, and he said, we have to have funding, we have to fix this problem. So now women are going to find answers to a lot of things that happen to us 40 and beyond. Osteoporosis, why do more women get Alzheimer's? Talking about menopause, talking about the little things that we just don't know about. Why do women, hair loss? There's so many things that we're talking to one another as women, but we're not doctors. So it's kind of, we're finding out information from other women. As a mother, the child advocacy, I have seen as, I'm so happy for what you're doing about violence in the home. And I see it in my own classrooms. I hear it from my students. If anybody in the audience is a teacher, I think that, we are the safe haven for our students, and they come to us and they bring us their problems, and they trust us, and they expect us to find answers for them because they're hurting. So I commend you on what you are doing for children and children's advocacy. And, as an American, I think you know about the president and my initiative on the moonshot, the cancer moonshot, and because cancer affects us all. I'm sure everyone in this audience knows someone or has been personally affected by cancer. And one of the things that I've seen in the past, that I've seen the most, that breaks my heart, quite frankly, is that because I've lived through it as a mother and actually as a daughter, that my family could easily and readily get chemotherapy and cancer treatments. And people in Indian country have to travel 100, 200, 300 miles to get chemotherapy. That's just wrong. That's wrong. And I've seen, people go through chemotherapy, and you go through that treatment and you get in the car and then drive all the way home when you feel so weak and sick. That's something that we really have to work on and amend, that there are more centers. And so Joe realizes this because we opened a center in the Navajo Nation, because this was one of the main problems that they brought to us several years ago. So I just want to say, when I said in my speech that healthcare is important, it is important. Your health is important to me and to the president and to Doug and to our vice president. And we will not stop working to help you, because health, if you don't have your health, you have nothing. So thank you for having me here, having Doug here, for inviting our administration. We will continue to support you, and I hope you realize that we're behind you, and we're going to keep moving forward. So thank you for having us. Thanks.
Thank you.
Okay.